So plantar fasciitis is a foot condition that I see very commonly throughout their practice from all ages. Now exactly what it is it's pain in the foot. Typically it will take place in front of the heel and can run up through the arch of the foot. Now what plantar fasciitis is it's inflammation of the attachment of a ligament or the fascia that attaches to the front of the heel. And that fascia attaches all the way through to the base of the toes. Now, often a big cause of that is going to be overuse. If you're a child who's playing a lot of sports, it's very, very common. Can happen in middle-aged people if they're wearing the wrong footwear. They're on hard surfaces for long periods of time. If you're really tight through the calves and through the Achilles, it can place a lot of stress on the ankle and the foot. If there's some underlying structural abnormalities in the foot that require orthotics, that can be another cause of it. Often I'll see alignment issues in the knees, in the ankles and the hips. That can also contribute to being a causation. So with the treatment of the plantar fasciitis, we take a multifaceted approach to make sure we're checking everything. Typically what I do is I check the alignment of the pelvis, the knees, the foot, look at the overall movement. I want to see whether there's any structural changes in the foot that will need orthotics and refer to a podiatrist, because that can be one avenue to provide a lot of relief. Typically what I'll start with the patient is I'll start stretching the fascia. Easiest way to do that is just across your leg. Grab your big toe and just pull it towards you, and you'll just feel a stretch all through here. You will feel some pain, discomfort through that area as it stretches it. Just bear with that. Second thing I'll get patients to do is I'll get it to ice it, especially at night or first thing in the morning. Often with the plantar fasciitis, you'll get a lot of pain first thing in the morning when you first start to walk around, especially on floorboards or any hard ground. The third treatment protocol that we use, we encourage patients to get a golf ball. Often I'll encourage them to get a tennis ball, throw it in the freezer, it hardens it up. I specifically like to use a lacrosse ball that we have in the practice, and what I do is I just place a little bit of weight on the foot, and I just roll it to the front of the heel and then to the toes and just back again. I don't want to push too hard on it, but just enough to make sure that we're breaking up those fibers in the fascia to allow a bit more flexibility through the arch of the foot. You can roll it this way, and then you can also roll it crossways. And just working all the way backwards and forwards, and doing this for about 3 to 5 minutes on the involved foot. The fourth exercise that I get patients to do is get a foam roller. I'll just move that out of the way. And we want to increase the flexibility and the mobility of the calf muscles to make sure we get all of that range of motion through the ankle, taking pressure off the arch of the foot. So with this, just applying a little bit of pressure. I want to take the weight here, and I'm just rolling up and down, up and down. What I'm doing here is I'm just breaking up all the adhesions. It's almost like a trigger point of the muscles. With the foot itself, I'm gradually turning it out, and then gradually turning it all the way in as I'm rolling up and down. This just makes sure you get all of the muscle. And then I want to roll that foam roller up a little bit higher and do the same process all the way through. Now, if we find that the foot itself needs to be assessed, then typically what we'll do is refer you to a podiatrist to make sure that if orthotics are needed, that they're fitted to take the pressure off that arch. You may find that the foot itself needs that support. And then lastly, we also incorporate strapping. Strapping is such an important way to take the pressure off the arch of the foot and to give it immediate relief when you're suffering from it. If you have any questions at all, please let us know, but we want to make sure you're able to self-manage this as best as possible.